Hello everyone, welcome to PhysioLead. Today I am going to explain accessory movements of exercise therapy, which is a continuation of my passive movements of the previous video. If you have not watched my previous video, please go and check into my channel. So now I am going to explain this accessory movements. Accessory movements are also called as joint play movements. These are the movements that occur along with the physiological movement. What is the physiological movement? It's nothing but a normal movement, that is anatomical movement, that is a flexion, extension, etc. So when a flexion or extension occurs, along with this flexion and extension movement, there is a joint movement that is occurring. That is only nothing but our roll, glide, and slide or spin. Glide or slide are both the same. So roll, glide, and spin are the accessory joint movements or accessory passive movements. These passive movements cannot be isolated. That is, you can't do these accessory passive movements alone. Until and unless you are doing a normal joint movement, that is anatomical movement, you can't do this movement alone. That is, you can't roll your joint surface instead of without doing your anatomical movement. So these normal joint movements cannot be isolated in a voluntary movement, but these can be isolated by the therapist as a treatment procedure, which I'll be telling you at the end of the video. And also these movements are absent in the abnormal joint conditions. What are the abnormal joint conditions? It's a severely or significantly stiff joints, which will be mostly seen in the rheumatoid arthritis condition, or else our osteoarthritic conditions. So as I said you in the passive movements, the principle will be almost same. That is relaxation. We have to ensure that the joint is placed in a relaxed position or the limb is placed in a relaxed position. Fixation, the proximal joint should be fixed and it should be given a good support. That is a support, comfortable position we have to use, and we have to give a good support. The entire limb should be in a well supported manner. And the other one is ROM. ROM is nothing but the range of motion should be in the available range. That is the how much the joint is providing us. In that range only we have to do the accessory passive movement. And the what are the coming to the effects and uses. So it is mainly helpful for the contribution of the normal function of the joint. So if you are doing any normal function of the joint, then obviously this accessory passive movements occurs. It means that accessory passive movements occur only when the joint is normal. So when accessory passive movements occur, normal joint function also takes place. So another point is when the I have said you before only, it can be isolated by the physiotherapist. When it is done by the physiotherapist, what are the uses? So it will increases the lost ROM. So in the rheumatic arthritis or any osteoarthritis, we will lose our rheumatoid arthritis or osteoarthritis. We will lose our ROM. So that is, ROM will be decreased. So when we do the accessory passive movements, our ROM will be gained. And next point is, it will maintain the joint mobility. And the last point is, plays an important role in the treatment of a patient who is unable to perform the normal active movement. As I said you before only, it is absent in the abnormal joint condition. So if the person's joint is good, well and good, why do we need to do this movements, isn't it? So normal active movement is lost. In this case, in this condition, we give our passive movements, accessory passive movements. So I have said you, it is isolated by the therapist. How does the therapist isolate this? So it is nothing but when a therapist can isolate this movement, accessory passive movement, by applying a gentle pressure to a joint in a specific direction. So we apply a gentle pressure to a joint in a specific direction. It will produce a small amplitude movement within the joint while minimizing any voluntary muscle contraction. So without any muscle contraction, we just slide the joint, we just move the joint with giving a minimal pressure. And also these movements are effective in targeting the play of the joint without initiating the full ROM exercise. So we are not giving a full ROM exercise, we are just giving a small amplitude pressure, so that the joint surface is moving, not a movement is occurring. So that is where we isolate a movement, isn't it? That is where we isolate the thing. Instead of doing the whole movement, we are just doing whatever we want, whatever the specific passive movement we want, we are doing that movement. Using the technique of Maitland's mobilization, the therapist control movement to isolate the specific joint glides, rolls, and spins. So we use Maitland mobilization technique, which will be dealt in the upcoming videos. So this is all about your accessory passive movements. If you have any doubts, please comment down, and please like, share and subscribe to my channel. Thank you.